You are doing your graduation in medicine, right? You are doing MBBS, fine? Okay. Then you might be just thinking for a time being that sociology is a subject which is generally taught at the Department of Social Sciences, okay? It is part of arts, humanities and social sciences. Why you are asked to study it? The first question you have to just keep in mind, why to study sociology? If you are a doctor or if you are studying medicine, it is easy to understand that knowing about the composition of medicine or doing surgery or learning about the medicine, these are all useful. But how is sociology useful? Right? That is the first question. You might be thinking for a time being that somebody in the university has decided one day that let's teach sociology to medical students also, and you are forced to study it. So here what I will do, I will argue that sociology is very much important for your life, for your profession. So you would be asking, how is it so relevant? How is it so useful? What I will try to do, I will take an example, and then it will be very much clear that why sociology and the knowledge of sociology is required for those who are in medical profession. There is a hospital, okay? Any hospital, let's take that there is a hospital in Gulbarga, and you will become a doctor, okay? And a lady comes to you with her child, and she says to you that he is ill, okay, he is having fever, and then you have given medicine, paracetamol, and you have said go and take paracetamol and take rest. After 3 days if the fever will go. The fever has gone, but the lady has again come back to you after 1 month making the same complaint that my child is again having fever. Again you have given paracetamol, this time antibiotic, you have done the blood test, the lady has gone back. The boy was okay after a few days, after a week. Again the lady has come after 2 months, and she is saying that why my child is getting ill, okay. I work as a domestic maid, and my child becomes ill very often, but the child of the owner of the house where I go to work, they are not ill. So why the God is cursing my child? What bad thing I have done? And I sometimes doubt that you are not a good doctor, or you give me such a medicine that my child doesn't get a fever for, let's say, 2 years, 3 years, he will be okay. Then you think, and then you reply, there is no medicine that I can give it to you, and it can ensure that you will not fall sick for 2 months or 3 months. So then the lady has asked, then what is your profession? There is no use of being a doctor when you cannot cure the child. Then you have replied, see, I can give you medicine. The medicine can cure the child for time being, but the control of disease cannot be controlled or cannot be done by the use of medicine alone. The medicine is important, but medicine is not sufficient to make the society healthy, to make your child healthy. So there are other factors. So you are a doctor, you have to know surgery, you have to know medicine, but you have to keep in mind, to make an individual healthy, to make society healthy, to make this country healthy, to make this world healthy, medicine and surgery has very little role to play. If the child does not get pure water, if the child is having no house, no shelter, if the child and the parents do not have proper sanitation facility, if they live in slum, if they are forced to drink contaminated water, then medicine alone cannot cure the person. So then the question is that why some people have access to pure water and why some people do not have access to pure water. Why some people live in a good house where you have garden and why some people are having no house. Okay, they are living or they are sleeping in the pavement. So here comes social policy. Social policy regarding medicine and health are as much important as medicine. You understand my point? So when it comes to social medicine, when it comes to social policy regarding health and sanitation, then sociology is very important. Because your teacher at let's say at medical department will be able to teach you how to give drugs, how to give medicine, how to give injection, okay, how to do surgery. But I will tell you what is social policy, what is society, what is community, why the cases of anemia is more among poor people, more among Muslim women. Okay. The cases of tuberculosis is why the cases of tuberculosis is more among poor people. Why the cases of heart disease and obesity are more among the rich people. And what is the policy of the government as far as the health is concerned. Why the government is spending more money on, let's say, this sector, but it is spending very less money on health. You know it very well that there is, I think there is an ideal ratio between doctor and patients. I think if I am not wrong, it has to be something around 1,000, one doctor per 1,000 men or women, you understand? But in India, I think it is around 1,500. So why doctor is under pressure? Why can't our governments set up more and more hospitals? Why hospital and why medical facilities are not there in rural areas? Why they are not? Why such facilities are not there in Muslims area, in the areas which are inhabited by Dalits and the lower caste? You understand my point? In rich area, you will find that hospitals will be in a better conditions, but in the poor locality, you will find either hospital does not exist or they are not in a good conditions. You understand what I am trying to say? What? Repeat and say something. What is your view?
Sir, you are saying medicine is not only the important role in patient.
Yes.
But also society, culture.
Yes.
How we live, where
Yes.
we live,
Yes.
what we eat,
Yes.
what we drink.
Yes. And what is the policy of the government? What is our norms and values? For example, I'll give you another example. In 2019, my father was ill and he was undergoing operation. So you know it very well that if you have to get your relatives operated, you need to donate blood also in hospital, and the blood cannot be purchased. You understand? Some relatives and some friends have to go there, volunteer and donate blood, and then you get blood from the blood bank. You know it very well. So there were some patients' relative there. One of them has asked me, I need blood. So I said, if you need blood before the operation, bring somebody from your relatives. You have to give 2 units of blood and then you will get 2 units of blood from the blood bank. Then the lady said, no, 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 I will not give blood. If I give blood, I will become weak. I have money, I can purchase blood. You understand? I can purchase blood. Where is the blood? Where is the blood? I want to purchase. Then the nurse came and nurse said, see, the blood cannot be purchased and sold. You have to bring somebody. She said, I am not so poor. I have money. I can buy any blood. You understand? So why this example is important? Because still people fear that if you donate blood, you will become weak. You will even die. Or the vitality of your body will go away. You understand? So the profession of a doctor is not only to give medicine, but to also understand the cultural values, the cultural norms. And then if you don't understand, then you will not be able to make correct policies. So you have to, suppose you become a doctor, then you have to keep in mind that in this area, people are not ready to donate blood. So you cannot take danda, you cannot take a rod and beat somebody, but you have to drive what? Drive awareness program. You know? You have to have awareness program, go and tell people that, see, suppose if I am a doctor, I will start giving blood and I will say, see, I am a doctor, I am giving blood, don't fear, if you give blood, it can save the life of people. So the culture of the people, the values of the people, their tradition, the community, and what community is thinking about, these are all important to become a good doctor. If you are treating a person, and if the person, and every person has some community, is having some, let's say, some caste, some religion, some values, and if you do not respect that values, then you cannot become a good doctor. You understand? This is, you take your college, okay? Here the boys and girls put up dress in a particular way. If you go to, let's say, colleges in Bangalore, you will find that they will put up dresses in another way. You understand? So the dress code is also very important. If you become a doctor and if you are working, let's say, in Bihar, you have to understand the values, the rituals, the traditions of people in Bihar. Otherwise, you will not be able to treat them. You understand? For example, alcohol is used in medicine. You use, no? But some Muslims believe that alcohol is not permitted by their faith. There is also another interpretation also, but that if the alcohol is used to save the life, it can be permitted. Okay. So you have to know these values. You understand? You have seen the controversy around polio drops. See, if polio drops, if the team taking polio drops went to some locality, some people think that these drops are basically meant to make them ineffective as far as production is concerned. Okay. Reproduction is concerned. It means that if they believe that if they take that polio drop, they will not be able to give child, give birth to child. Okay. So this is a ploy. This is a conspiracy to stop the growth of the population of that community. So people fear, and you understand this point also, that if the polio is like this, that if it can only be effective if everybody takes it. If some people are left out, then it is not effective. So the point which I am trying to understand, that the job of a doctor is, of course, to know about medicine, to of course know about surgery, to of course be master of your subject. But at the same time, since you are a human being and since you deal with human beings, you operate in a society, and your medicine department is governed by the government policies, and the government policies can help you, or the wrong policies can also the wrong policies can also put impediments in your path. So you have to know about community, health, tradition, society, norms, policies, government policies. If you do not know it, then the medicine alone is not sufficient. Is it clear? You tell me what I have been trying to say.
Just prevent this socialism.
You speak a bit louder and speak confidently. I'm not going to punish you. Yes, be happy, laugh, smile, and then speak. Yes.
Sir, first we prevent the medicines to the patients
Hmm.
and awareness from the socialism
Hmm.
and bring cure all community
Ah.
and socialism and norms.
Hmm. It is no. I said sociology. Yes. So the point is that medicine is important. See, don't think that I am saying that don't give medicine. No, medicine is important, but the more important is the policy. See, you take the example. Mosquito is a problem. Okay. So what we do? We bring coil. We bring mosquito liquid. Now we are also using mosquito this liquid and something like that. Okay. But do you think that the mosquito problem can be solved by that? No. The mosquito problem can only be solved when we ensure sanitation. Okay. When there is no water which is kept there, which is out there, there is no stagnant water. So a stagnant water, if there is a stagnant water, mosquito will be there. So if you do not keep your area clean, mosquito will be there. It cannot be cured by malaria medicine. The malaria medicine is important and it is needed when somebody has caught it. But it is also argued that prevention is better than cure. So to prevent something, you need to know beyond medicine. You need to know society.